Heat-related illnesses. Heat-related illnesses are a set of preventable conditions ranging from mild forms such as heat exhaustion or heat cramps to potentially fatal heat stroke. Hot and humid conditions challenge cardiovascular compensatory mechanisms. Once core temperature reaches 104 degrees Fahrenheit or 40 degrees Celsius, cellular damage occurs, initiating a cascade of events that may lead to organ failure or even death. Early recognition of signs and acute measurement of core body temperature are crucial to the rapid diagnosis of heat related illnesses. Milder forms of heat related illnesses are manifested by symptoms such as headache, weakness, dizziness, and an inability to continue activity. These are managed by supportive measures, including hydration and moving the patient to a cooler place. Hyperthermia and central nervous system symptoms should prompt an evaluation for heat stroke. Initial treatment should focus on lowering core temperature through cold water immersion, applying ice packs to the head, neck, axilla, and groin as an alternative. Additional measures may include transporting the patient to a cool environment, removing excess clothing, and intravenous hydration. Delayed access to cooling is the leading cause of morbidity and mortality in individuals with heat stroke. Identification of at risk groups can help individuals provide preventative measures. Heat illness. Heat illnesses are very common problems in athletics. Some teams are restricted to the days and times that practice can occur, and this can present some unique issues and challenges. Heat-related illness represents a continuum of pathological states and affects a diverse population. Over a 23-year period, it accounted for nearly 5,000 deaths in the United States. When the heat index is higher than 95 degrees Fahrenheit or 35 degrees Celsius, mortality increases in relation to elevation of temperature and the duration of a heat wave. In most cases, these fatalities are preventable. Populations at risk include older individuals, children, and people who perform strenuous outdoor activities. People with heart and lung disease, individuals with chronic mental health issues, and those taking medications that interfere with salt and water balance are also at an increased risk. Early recognition of the signs and symptoms and rapid cooling are crucial because heat stroke is a medical emergency. There is a lot of literature that is being published regarding heat illness and their treatment, so it's very important to keep up. In order from the least to most severe, heat illness includes heat cramps, heat exhaustion, and then heat stroke. When it's hot, it's hot. Here in South Texas, we know about the heat. Some of the most recent literature has suggested the following practice. Rectal temperature is the most reliable way to assess core temperature and differentiate between heat stroke and milder forms of heat-related illnesses. Cold water immersion is the preferred method for cooling in exertional heat stroke. Rapid access to cooling is the most effective method to prevent heat stroke fatalities. It is important to note that on the level of evidence for all three of these practices, it is only a C on the SORT scale, which means that this evidence is coming from a group consensus or an expert opinion rather than from clinical trials. It would be highly unethical to subject participants in a study to this level of heat illness, and therefore expert opinion is the best we have to go on. Heat cramps. Heat cramps are the first level of heat illness and are extremely common. Heat cramps are caused by working hard in the heat, sweating heavily, and possibly inadequate fluid or salt intake. There has been some debate regarding the use of pickle juice to treat muscle cramps. Science has suggested that the vinegar in pickle juice may help prevent muscle cramps. Heat cramps or exercise-associated muscle cramps can occur in any setting, but are more common when exercising in a hot and humid environment. Dehydration, depletion of electrolytes, and sodium loss from sweat all accelerate this type of environment, especially in those who sweat profusely. Treatments may include rest, prolonged stretching of the affected muscle groups, and oral sodium ingestion. Intravenous normal saline may be used for more rapid relief, especially for severe diffuse cramping or when oral repletion is not possible. The signs and symptoms of heat cramps include painful muscle spasms, particularly of the calf, thigh, or abdomen. They may be mild or severely painful. The individual is normally alert and oriented to their surroundings and can talk to the healthcare provider. The skin is wet and warm from excessive sweating. The body temperature, pulse, and respirations are normal or even maybe slightly elevated. To treat heat cramps, move the person to a cool area. Rest and replace fluids, preferably with fluids with an electrolyte solution. IV fluid replacement may be necessary for individuals with multiple muscle cramps or cramps that return. Stretch the muscle, massage with ice if possible, or ice the cramp. It should be noted that this is the first stage of heat illness progression. These patients should be closely monitored for future heat illnesses and are more likely to suffer from repetitive heat cramps or other heat illnesses. Heat exhaustion. Milder forms of heat-related illness are associated with core temperatures that are less than 104 degrees Fahrenheit or 40 degrees Celsius, and no central nervous system symptoms. Heat exhaustion is the inability to continue activity because of environmental conditions, and is postulated to be caused by a central mechanism that protects the body in times of overexertion. Once a person has had heat cramps or heat exhaustion, they are more likely to get it again. Heat exhaustion is caused by prolonged sweating with inadequate fluid replacement, and it may be associated with diarrhea or illness. This is basically a state of severe dehydration. Common signs and symptoms of heat exhaustion include headache, weakness, dizziness, goose flesh or goose pimples, nausea, vomiting, diarrhea, irritability, and loss of coordination. The skin may appear pale or even ashen, with associated tachycardia or hypotension. Normal mentation is maintained. Patients with heat exhaustion should remove excess clothing and be moved to a shaded and cool environment. They should be placed in a supine position, preferably with their legs elevated. Oral fluids are preferred over intravenous fluids for rehydration in those who are conscious, able to swallow, and not losing fluids secondary to vomiting or diarrhea. Vital signs should be monitored with transport to emergency facility if symptoms do not improve after 20 to 30 minutes. You should move the individual to a cooler area, either shade or preferably inside to an air-conditioned facility. Remove extra clothing. Ice or fan the body to help with conductive properties. Give cool fluids as much as possible. The individual may need an IV for sufficient fluid intake, and rest and rehydrate for 2 to 3 days following the incident. Heat stroke is a true emergency that requires immediate recognition and treatment. It is defined by a pathological elevation of core temperature of 104 degrees Fahrenheit or greater and associated central nervous system disturbances. Classic heat stroke often develops slowly over days. It predominantly occurs in older individuals or those with chronic illness. Exertional heat stroke has a more rapid onset and is associated with higher core temperatures. It generally occurs in a young, healthy individual and is characterized by hot skin, with or without sweating, and central nervous system alterations. Early recognition of the differences between heat stroke and the milder forms of heat related illness is crucial to avoid morbidity and mortality. The signs and symptoms of heat stroke include no sweating, hot and dry skin. The individual may be red or have flushed skin, strong and rapid pulse. The body temperature is markedly increased. It's not uncommon for an individual to have a core body temperature of 105 to 108 degrees Fahrenheit or even higher. Disorientation or confusion is common, as well as headache, staggering, respiration increases. Blood pressure seldom rises, and unconsciousness is common. Physicians or athletic trainers who are considering the diagnosis of heat stroke should obtain a rectal temperature as soon as possible. Remember, this is a life threatening emergency, so there's no time to waste. Treatment begins with stabilizing the patient's airway, breathing, and circulation. Early activation of emergency medical systems, or EMS, is important, but we should cool the body before transporting. Move the individual to a shaded area. Remove any excess clothing. Cool the body with water, ice, a fan, or any other means possible. Give the individual fluids, but only if they are conscious. We need to act quickly to save the individual's life. Morbidity is greatly reduced with rapid cooling. If there are no other life-threatening complications, on-site cooling before transport to an emergency department is preferred. Cold water immersion is the treatment of choice when available. It is associated with the lowest morbidity and mortality rates, and patients with exertional heat stroke treated with cold water immersion have a survival rate of almost 100%. Large cooling tanks are often used at outdoor activities such as football practice or mass participation events. Although the cooling rates for cold water immersion have been shown to be superior, applying ice packs or cold wet towels to the head, neck, axilla, and groin is an alternative option. Rapid air movement with a fan in combination with spraying a moderate temperature mist of water encourages evaporative and convective cooling and is also effective. Intravenous hydration should be initiated as soon as possible to protect renal blood flow and avoid a complicating condition such as rhabdomyolysis. Patients evaluated in the community setting should be moved to a cool, shaded environment and have excess clothing removed while an ambulance is called. As a summary of the determination of medical referral for heat illness, heat stroke is an extreme emergency. The individual must be cooled as quickly as possible and then transported to the nearest medical facility. Heat exhaustion, the individual should be removed from activity and should have medical attention if hydration and other means do not eliminate signs and symptoms. Heat cramps, the individual may return to activity once they are cooled, rehydrated, and free of cramping, but that individual should be closely watched and monitored for reintroduction of symptoms.